Hi, everyone. Welcome to Minority Mavericks. This is Angel Leon, your host, and this is the show where you can listen to the stories of all minority mavericks out there, investors, founders, and entrepreneurs of this world. And in today's episode, we'd have Jennifferre Mancillas, and she's the founder of Adni. Welcome to the show, Jennifferre.
Oh, thank you so much for having me. So excited to share and to kind of dig in a little bit.
That's great. Good to have you, Jennifferre. Thank you for taking the time to be on the show and tell us your story. So, to that end, let's start with that. Let's tell the audience your story a little bit. So, if you want to tell us your journey, tell us where you're from, your background, and everything you've done so far, and what to become the person that you are today.
Yeah, happy to share. I grew up in Central Valley of California. I'm still here, actually. Central California is very big on agriculture. More than 50% of the population is Hispanic. I went to public schools. I was the first person in my family out of my grandmother's 11 siblings and her 6 kids and all of my cousins to go to college and graduate. There weren't particularly great role models for me when I was younger as far as women to aspire to be, doing bigger things in the world. I do remember though that I had a pediatrician, and she was a woman. I remember admiring her so much. This woman was educated, a doctor, a minority. She ran her own practice, and she was able, on top of all that, to help people. And I knew that I wanted similar things for my own life. And I went to a city college to get my nursing degree, and I started working as a nurse, and then I got my bachelor's degree. And then when I was working within the hospital organizations, I realized that I had a knack for being able to identify and solve for pain points. And so I was constantly creating some sort of apparatus or toolkit or program to improve things like patient safety or workflow efficiency, or patient-centered care. And it was something that I really enjoyed doing. And then one day I got caught up in a Google search rabbit hole, how one thing always leads to another and then you end up somewhere wild. But I came across an application for Johnson & Johnson. They were doing, they were going to have a nursing innovation fellowship program. And I remember thinking how cool that sounded, because it was everything that I was very interested in doing. And the premise of it was to move the needle in healthcare in ways of innovation, entrepreneurship, and leadership through the nursing profession. And so I applied to that fellowship on a whim, and I almost gave up on the application twice because it was lengthy. And each time I thought that I had finished, there was another component that I needed to do. And I almost didn't do it 2 times. And then I received the call letting me know that I was one of 12 nurses accepted into the program. And I remember thinking that it was very big, like an underdog feeling at that moment, because the other fellows who had been accepted were they had amazing titles, and they were professors and had doctorates and came from these very well-known health systems. Right. Or they were, in my perspective, they were already accomplished. And so it was a great feeling to feel like I was amongst the stars at that moment. And it was a huge win and a catalyst for all things innovation and to move forward. But Johnson & Johnson flew us out to a hackathon that back in fall of 2019, it was pre-COVID. And I met my now co-founder there. He was at the time a nursing student at the University of Pennsylvania. And we had really synergistic ideas about what we wanted to do in healthcare and the problems that nurses and healthcare workers encountered. And then we had a seedling of an idea when we had met at that hackathon. And it was really, to kind of give you the full story, I'll give you the abridged version was that we realized that it was difficult for healthcare workers to see when they were caring for patients in low lit or dim areas. So we created a wearable light for healthcare workers to enter their patients' rooms and be able to see everything, have hands-free to care for their patients inconspicuously as possible and keep patients resting. And that was really the flagship product for us. We knew that it was just going to be a springboard for more that we want to be able to provide the healthcare workers and that community at large. That kind of led us to understanding that there was no place for healthcare workers to find niche items like our wearable Unite Light for healthcare workers. There was no space. Everything in our professional ecosystem is very disjointed and siloed. And we love the idea of having a platform that was a sense of truth, that everyone can find the gear and the resource that you need, because it is not well known outside of healthcare or the nursing profession, but nurses are oftentimes responsible for purchasing our own shoes, stethoscopes, scrubs, compression socks, like you name it, our continuing education. Sometimes you have to pay for parking depending upon the institution that we're working at or the organization. And we also love the idea about being able to reduce those out-of-pocket expenses. So we launched a marketplace that to date has thousands of products that are created by healthcare workers. Majority of 75% of the sellers that we have are other healthcare workers that have created some sort of brand or resource or product for other healthcare workers to support them. When we launched that, we got numerous enterprise clients, mainly staffing agencies and nursing organizations who were interested in leveraging our platform to be more of a rewards for their clinicians that they worked with and were trying to engage. And at that point, we knew that there was a great opportunity for us to be able to use our platform to help with this engagement piece, because there's just this cyclical cycle of recruiting being very expensive and retention being horrible. So how could we fix that? And so by use of our AI gamifications and automations, we're able to kind of bridge the gap and make the hiring time shorter and the retention time longer. So an all-in-one clinician engagement platform, a long way from a light, but that's where we've landed on to date.
Very cool. Yeah, definitely. I love what you guys are doing. Incentivization, recognition, all that's very important for users. We love that as consumers as well. We love our loyalty programs. We love all those kinds of things, right? And this is basically that. You're building that kind of loyalty program at the same time, because there's a reason of me doing this. There's a reason of why I'm taking onto these tasks, right? At the end, I'm going to get some sort of reward. And again, we all love that. So that's very, very interesting that you are applying that into your platform. And I'm sure that you have a great story and a great career. And I'm sure that you had your ups and downs throughout your journey. Would you like to share a little bit about some of the challenges that you may have faced as a minority?
I think the biggest challenge that I faced, like being an unrepresented founder in this space working in tech, was overcoming the perception that many people have, not only about being Latina, but being a nurse and working in the health tech space. That's not your typical algorithm for people that you invest in. And I think that was a challenge to overcome, and we're still kind of come encounter with it on occasion. But most times folks automatically associate nurses specifically with caring for patients at the bedside, and really trying to flip the script and broaden the horizons that not only being Latina but being nurse is a benefit more than a hindrance in this space, because it allows you to see a scope of people that you may not otherwise see, and be very intentional about how you engage people. And then also allows you, through your lens of people in being a nurse, our lens to see people allows us to be successful across industries and roles. And then if you look at the founders that are able to be successful and take on venture capital funding, there is significant evidence to prove that those who are women and minorities ends up being more successful with that venture funding that they do capture versus their male counterparts. And I think that's really profound, and being able to be in this space and even be inspirational to anybody at all, especially living where I'm living. I think that that means so much. So I think that's one of the biggest challenges to overcome, just the perception that people have, and how we overcome that really is just do the things that you say you're going to do and do them well, and have nobody have excuses about why you were able to be successful, and just do the thing you set out to do, and make an impact. And we're still on our journey to do so, but yeah, it's a fun one for sure.
Yeah, and a long one probably, right? But that's
Yes, right.
the fun part too. As long as you can say that, then that means you have a job. So it's again, as a nurse, though, I really appreciate what you guys do. I personally have a family member that she's a nurse. So to all nurses out there as well, thank you for all you do. I come from, I'm a military background myself. So it's really cool to see that, people with our backgrounds in terms of first responder or military, we also have, right, the ability to found a technology company or be part of this, right, startup world as well. We don't have to have a finance degree, or we don't have to have an MBA, for example, in order for us to be as competitive as anyone else. So again, I really appreciate everything you guys do, Jennifferre.
Thank you.
Let's dig a little bit more, maybe into Adni specifically, and what you guys do there, and then maybe we can discuss a little bit about how you guys are including all of this into your platform in terms of inclusion and diversity. Before getting into the diversity inclusion part, I wanted to maybe talk a little bit about AI in healthcare, if that's okay. I know it's kind of like a hot topic, but I would love to, just to see your point on it. So, how does your platform guarantee, right, the ethical use of AI technology, particularly handling all the clinician data, right, and engagement data that you guys handle? And then, of course, given this big increase, right, influence of AI in healthcare.
Yeah, I think that's a great question. And I think that the power of AI can be kind of alarming, or people enter it with trepidation. But I think in our specific space where we're currently building in, which is healthcare staffing and engagement, I think that AI has an incredible ability to be helpful at ensuring equity of opportunity for minority healthcare workers. And specifically with the fact that if you are solely relying on people to vet people, oftentimes people come to the table with their own biases, realized or not prejudices, their inherent beliefs, and that can potentially cloud the recruitment process. So what we really appreciate about really using AI for is leveling that playing field and making sure that the qualified candidate is provided with the opportunities without prejudice. And because as nurses, we 100% are aware that if we're able to have more healthcare workers and clinicians with cultural backgrounds that mirror the community that they're caring for, we have better patient outcomes. We have better equity of care across the board for the patients that we're seeing. And I think that's the one of the added benefits of being able to use AI with staffing, specifically in healthcare, for that purpose. And I think that's what we're really honing in on and taking away some of those inherent biases that exist.
Yeah, definitely. That's a great, use case right there, right? For AI specifically. It's not directly into handling patient data or that kind of, PHI, but it's
Exactly.
more, staffing side of things. And it's a great way to use new technology and such a controversial technology in good ways. So it's really interesting what you guys are building there. I also love what you guys have in terms of this branding of re-engagement and, that parenthesis with the re. Can you tell me just a little bit about that, and how do you guys come up with that?
Yeah, I'm happy to do so. I think that engagement and re-engagement, what we were hoping to accomplish is when we've been having conversations with all of these amazing staffing agencies, one commonality with them was that they had this vast, stale clinician database of data. So clinicians that were in their pipeline at some point and fell off, that they really don't know how to engage or re-engage them again. They once were interested and had taken a contract or interested in travel, but for some reason or another, they haven't picked up another one. Then you have a whole nother set of clinicians who they haven't engaged yet, that haven't taken a contract with them or a call with them. And being able to look at it as, we want to be able to help you engage with your clinicians, past, present, and future. And that's where the parentheses for the re-engage came from, wanting to make sure that
Okay.
healthcare employers knew that we weren't just tending to new, but we were revitalizing everyone that they had already connected with at some point, to bring them back into the system, to show them value, to be able to engage them in a way that they were familiar with. I think that goes along what you had mentioned earlier about gamifying the experience. And a lot of that is due to the thoughts of this newer generation of healthcare workers coming into the fold, which is the first generation who has never known a moment without technology. From the way that they interact and they engage and they shop and they connect with one another, everything is rewards and instant gratification and likes and follows and comments. So how can we take knowing that and apply it to your healthcare profession and your career, and how can we make that exciting and provide value? And that's what we had landed on.
It's very interesting that we see all this technology, right, being used in different elements, right, in healthcare. And I really like the idea that AI, it's part of it all, right? I also like the idea that you guys are not reinventing anything, but you guys are trying to fix something that was broken. And again, you're not reinventing. I feel that throughout years, right, the system itself has been breaking down, and you guys are, with that branding that you have with the right, I think it's like you explained, that you guys are bringing all that together again, and just refreshing people. Hey, this is not as bad as it was. Come back again and see how we can give you a better experience. So that's very, very cool and very interesting, Jennifferre. And to talk a little bit just about diversity and inclusion at this point, again, given that AI is again controversial, there's also the controversy of the data or that's not existent, right? So, for example, as you may know, we have zip codes here in the United States where they're lacking of services, they're lacking of their daily basic life services like housing, right, food, transportation, these kind of things, right? And a lot of that data is not present because we're not necessarily searching for it, right? And that means that we're isolating a lot of people, right? And my question to you would be, how is it that your company is ensuring diversity and inclusion in creating this AI powered, right, clinician re-engagement platform?
Yeah, I think that all has to do with your initial mindset and who you're wanting to engage with your product in general. And I think that that's great advice for anybody. But if you're product and what you're wanting to put out in the world is going to touch a vast, like a wide amount of people who are very diversified, then from the very start of developing your product, getting input and feedback from a wide variety of folk with different cultural backgrounds and titles is important, because you can't build something from the very beginning and then only at the very end hope that it meets the needs of the people that you are trying to interact with and engage. And that's something that we've been very intentional about, from all the user interviews and demos that we've done, being able to capture feedback and insight from people who are of different backgrounds and social status and demographics. And if you are a nurse or you work in healthcare at any capacity, or even in other industries, just to be able to understand how our product and what we're developing can fit the needs of many. And I think that that is something that some folks often miss doing, and then wait until it's too late in the game and try to circle back around. But for us, in order to promote that diversity and inclusion, but making sure that we are hitting those needs, at our goal is to be able to think of them ahead of time and be able to engage with those people. And specifically, one portion of our platform that is one of the larger parts of our platform is the marketplace, where we have sellers who are mostly healthcare workers, but we are very intentional on our social side of things to be very inclusive. So we will highlight minority founders often, Black-owned businesses, highlight our healthcare workers and our sellers who identify as being LGBTQ, trying to go ahead and level the playing field so that everyone is included on the public side, just as much as we're thinking about that internally with the build out of our team, build out of our product. So I think it's at the forefront of our mind when we are not only creating this AI tech platform, but also how we are engaging with people in a social manner on these different platforms.
Very nice, Jennifferre. Thank you for that. And I would like to maybe talk about just your future right now, right? And maybe any plans that you have for yourself, any plans that you have for the company. That would be great to, for the listeners to know where Adni's going, right? As well. And then if you want to also maybe give a little bit of advice to all aspiring minority entrepreneurs or founders out there, talk to your people right now and just tell them some piece of advice.
Yeah, I think for Adni specifically, we're very excited about rehumanizing healthcare staffing and putting more value into the clinician experience. I think post-COVID, it's a different way of life now for the recruiting process and to retain healthcare workers from an organizational standpoint even. And we're very excited about being able to disrupt that whole process and be present with nurses from the start of their career as they continue to grow in their profession, but being able to make it easier for healthcare employers to hire the right candidate and make sure that they're fitting the needs of the communities that they're serving and doing it well and doing it quickly. So the sky's the limit. We're really excited to be able to grow with the coming new year. There's lots in store for sure, so stay tuned. As far as words of advice for anybody out there who has an idea or a passion that they're wanting to come to see to fruition, and you're wanting to go down this founder life and make it happen, my one biggest piece of advice would be to make sure, or two pieces of advice rather, would be to make sure that it's something that you are utterly passionate about, because the no's are far greater than the yeses. It is a rough road. Not that there aren't any days that you get to celebrate, those come too, but it is it is if you're looking for great work-life balance, or you're looking for an easy way to go ahead and have something to do with your day-to-day, a founder life is not it. But do know that it is really rewarding in so many other ways. And my second piece of advice is to find people who are going to be in your corner and support you. That can be family, yes, but also mentors and advisors. Highly suggest you find somebody who can not only give you feedback when you need it, but also who's going to be able to rally you and encourage you through the moments that get rough. Those people make everything. And having people like that alongside your journey can make all the difference. So find something you're passionate about and find your people.
Thank you, Jennifferre. That was great. We loved your story. There's a lot of passion, a lot of persistence, a lot of vision. And also, we thank you for the work that you're trying to not just, do for Adni, but also for all the nurses and clinicians out there. Is there a way that clinicians and nurses out there can get in touch with Adni at the moment?
Yeah, it's adni.co. So adni.co.
Cool. And they'll just go there and sign up, and they can start getting part of the ecosystem.
Absolutely. So adni.co, and you'll be able to either as a clinician shop for your gear and resources, or if you're a healthcare employer, be able to utilize our platform to engage your clinicians and make staffing easier for yourself.
Very cool, very cool. So everyone, this was Jennifferre Mancillas. She's the founder of Adni. And as you heard all of our conversation here, Adni is an AI-powered clinician re-engagement platform. And we really loved Jenniffer's story here. Again, lots of passion, lots of vision. So again, Jennifferre, thank you for being on the show.
Absolutely. Thank you for having me.
Great. This was great, Jennifferre. Thank you. And everyone out there, this was Angel Leon, host in Minority Mavericks. And this is the show where you can listen to all the stories of all minority entrepreneur, founders, and investors out there. See you next time.